We're going to roll straight into our next session because I'm conscious of timings. And of course, we are familiar with Ashish Koshy, who is a group COO of M42 and a good friend of mine on stage from Arab Health. Welcome to the stage, Dr. David Sinclair, Professor of Genetics at Harvard University, and of course an advisory board member, and Dr. James Mault, thank you for remaining on stage with us. Ladies and gentlemen, please give them a big round of applause. And thank you to my audience, because you've been giving us very enthusiastic facial expressions. I did say I was going to open it out to the audience earlier, but I was a bit selfish with the earlier panelists. This one I do promise, so please have your thinking hats on. We're going to be diving deep into the role of AI in personalized health and precision care. So your burning questions, have them ready. I'm going to coming to you in about 10 minutes' time. But to begin with you first, Ashish Koshy. M42, such an exciting point in the journey. The advisory board launched yesterday. Tell me about your personal response to this and your vision for what can be achieved in collaboration.
Thank you, and good morning to everyone, and thank you for having me, and thank you to David and Jim for joining, and Jim especially for a back-to-back session. We are extremely proud of building together this advisory team, which we think is a global team of experts that sort of fits into our vision of turbocharging what Hassan just mentioned previously, disrupting healthcare across the continuum of care. And you look at M42, I don't think, and we were having discussions yesterday over dinner, there is no single entity that does what M42 does, from patient services, from advanced diagnostics, biobank, digital health, HIE, all under one roof. And I think that's why we need a team of experts to come and tell us how to turbocharge the business, one, from a shareholder perspective, second, just from driving precision and preventative health.
Fantastic. And Ashish, of course, I know that you are integral to the M42 journey. You're integral to the decision-making behind the advisory board. So on this occasion, I'm going to get you to be my co-host. Sure. Can you please introduce Dr. David Sinclair? Why was he chosen as part of the advisory board for people who are unfamiliar?
So Dr. David Sinclair does not need any introduction. He is the founding father of longevity, and clearly, specifically on our omics pillar, what we are doing specifically in genomics, on epigenetics, he could play a wonderful role on just driving the aging clock that we are trying to work across there. And his name is synonymous to longevity, and I don't think I deserve the opportunity to make that introduction there.
I appreciate that. That's really good to hear. Dr. David Sinclair, welcome. Tell me about your response when you were initially approached by M42 to be part of this journey.
Well, thank you, Ashish, for the introduction. Thank you for having me here. And thank you to the M42 people for inviting me to be part of this very prestigious panel.
And
can everyone hear me okay?
Yes, thank you.
Can everyone hear me okay?
That's better.
Much better, okay. Can you understand my Australian accent, hopefully? Yeah, so I was saying thank you for the kind introduction. And also, it's a great honor to be part of this advisory board for M42. And the question really was how do I feel about it? Really, it's, I've been to Abu Dhabi many times before this, and was doing business and have friends over here, and have been for the last decade extremely impressed with. At first, it was the G42 group, and I've grown to know them well and love what they're doing. And I was so impressed with the genomics work that they were doing, and then later combining that with increasingly complex AI systems to understand the complexity of genetics. So I'm a professor of genetics at Harvard, so I understand the issues here. But what captured me over the past 10 years and really excited me about being part of this new wave of what M42 is doing is that the mission is extremely noble. The mission here is to make as many people, not just in the UAE, but in the region and then eventually globally, as healthy and as long-lived as possible. And what could be more noble and important than that on this very planet? And so to be able to be part of what I believe Jim just mentioned, which is that this is a new era in medicine driven by data, driven by analytics, driven by monitoring, and an understanding of the human genome, we are entering a new phase of human health where we will look back in 10 years and think that this was a real turning point, and that before that, in the 20th century and the early 21st century, we were doing things really in a medieval way, and this is really the dawn of a new era, and I'm so privileged to be part of this.
I think that's really exciting to hear those words from you directly. I think you're absolutely right when it comes to M42's very noble mission and what's happening here. Dr. James Mault earlier mentioned the very exciting feeling of what's coming out of Abu Dhabi. I think you're absolutely right. I'm going to delve into some of the more technical questions now. Dr. James Mault, we spoke earlier about the exciting vision of what we should be looking out for when it comes to tech-enabled health. What might be something that actually having a group of individuals, experts from very different but also overlapping expertise, what does this chemistry provide?
Well, we had our first council meeting yesterday, and I have to say it's just it's really exciting to be able to be part of the complementary nature of our different perspectives. And we're missing Sir Chris Evans. He's speaking in one of the ballrooms right now. But Chris is a pioneer of the biotech industry. David is a pioneer in the genomics and epigenetics and longevity. David Rue in the artificial intelligence. I have a little something to do with medical grade wearables and physiologic monitoring, and you put all those together, and as Ashish just mentioned, there is nothing in the world right now that has the combination of those capabilities and the capital to capability kind of opportunity like M42. It really is there is nothing like it. And so to be a part of that, when David and I started talking about this, and Sir Chris and Dr. Rue, it was, yes, you want to be a part of something that exciting. Translating that into tangible, I would say, action plan is what we're embarking on now. And I think it's having the brainstorming sessions and reducing that down to execution is, I think that's another important part of what this group is about. We don't want to sit around and just talk about it. We really want to have something that has very, very near-term beneficial outcomes.
I really appreciate you taking us behind the scenes, that idea of the chemistry for that first council meeting, and also how M42 has been visionary in bringing people from different expertise together. As you say, it's unique, and that's remarkable to hear that. So thank you for explaining to us what's going on behind the scenes as well as on the scenes. Now, Ashish, when we were on stage at Arab Health earlier this year, we were talking about the role of AI still being quite misunderstood when it comes to the health landscape across the world. Dr. David Rue earlier talked about mitigating some of the risks, identifying them and making it clear where they can be actually addressed. Why is there still a resistance? As we're hearing from Dr. David Sinclair and Dr. James Mault there, this is exciting stuff. It feels like a no-brainer. But why is there resistance? And what can M42 do to address this?
So it's a wonderful question, and these risks will continue to happen, especially in the healthcare space. And during the discussion yesterday in the advisory council is specifically that. It's about setting expectations. Not every AI use case has a role to play in healthcare. I think it's critical that we ensure we have data to support the use case. We have high quality data that can be validated. And that's the reason why I think we have M42 rightly positioned, because our team works across in squads where here you have a team of physicians, AI engineers, the developers all working together to ensure that the model works and also has a critical factor, which is a risk that we see across the other companies that are working in AI, how to implement that in the right way. And you cannot do that without physicians. And our goal is to ensure we bring in the physicians and we're taking feedback from them. For case in example, we have M42 that's running there. The initial version, we were giving out results, and there was a feedback from some of the physicians that it needs to be referenced. And it became the first open access large language model that had references to those results. And immediately we saw that there was buy-in from the physicians. There was a trust factor. I think if we can ensure that it's transparent, it's traceable when decisions are made in building these models, and it can be understood why the decision was made, and we can share that with the entire team across. I think that's critical. And second, I think, is integration in the clinical workflow. We work on that and also apply AI on just the operational KPIs. I think it's a win-win scenario there.
And I think that's why events like this are really integral to that mission. As you say, it's about sharing the right information and ensuring that everybody is on board. And so it's wonderful to see you all here. I did say I'm going to open it up to the audience. So do have your hands ready. We're going to have mics. But I want to come back to Dr. David Sinclair, because you, of course, with your illustrious background, must get approached all the time. So I want to ask, what convinced you to say yes to M42? And what do you personally hope to achieve from this? Because I know that you're working on so many exciting projects. You can tell us. We're all friends. We wouldn't tell anybody. But, you know, this is like a key decision. Time is limited. Why M42 and why now?
Well, first of all, I love the region, I love the people, but also, as Dr. Mault said, it's an opportunity to do something that could not be done anywhere else that I'm aware of. I feel like I'm a global citizen, so I have citizenship in Australia and in the US, but I want all of humanity to benefit from these new discoveries that are coming online, and to be able to work with this group, M42 and the advisors and Hassan, is such an exciting opportunity. It's not just an honor. I'm a scientist. I get excited pretty easily about new things, and I'm super excited about bringing together the best aspects of what Jim and Chris, myself, and David can bring to the table, and we all bring different things, but to marry them with also the resources and already the data that exists, and bring in many hundreds, if not thousands of terabytes of data from the devices that Jim makes. It's an opportunity to do something that can be a showcase for the rest of the globe to follow, or to buy, or to collaborate with. And I can't think of many things, actually, that are more exciting than doing something that's never been done before for the benefit of humanity. That's why I eagerly said yes when Jim gave me a call.
Your excitement is definitely palpable. I'm going to bring in Ashish in just a moment, but as the professor of genetics at Harvard University, when it comes to genetics, give us a key example about what should we be looking out for? What's really exciting about this collaboration, and what should we be looking out for?
Well, so we're in a world where it's fairly cheap to get someone's genome from just a spit. We've done that for the last 25 years. Now the question is, what do you do with that data? How do you make it practical? And I think this is what was important, is that we can talk about it all day, but really making it actionable is the hard part. But I know that M42 has not just the will, but the way to be able to make this data very helpful for the patient. Right now, genetics and supplements and medicine, and even the practice of medicine, is a cottage industry. I was saying this yesterday at our inaugural meeting. You might say, how can you say medicine is a cottage industry? Well, I'm at Harvard Medical School, and the way we practice medicine now has not really changed in the last 100 years. We finally have an opportunity to change that, to help doctors make much better decisions with better data, assisted by AI, and also have much better medicines that they can bring to bear to treat diseases that have been designed and predicted to work by AI. So yeah, we're in a future where health and ultimately longevity will be beyond what we can currently even imagine for ourselves and certainly for our children.
Dr. David Sinclair, I really appreciate you underlining that point about disrupting the traditional ecosystem, which brings me nicely on to a very patient Ashish. You wanted to jump in.
No, I wanted to answer the question for David and Jim. Why M42? Why was it such an easy decision? I think the playbook that we showcased to both of them was how quickly we can industrialize national initiatives, be it from concept of a genome program, making it national, from a concept of a biobank to making it emirate-wide, be it from large-scale clinical trials. I think that is what I think they saw as exciting. And as Jim said, it was very easy when we just started the discussion, where do I sign? And I think that's the pitch here, and it's easy for other partners to also join here.
And it's wonderful for us to hear about that process behind the scenes, how the relationship started. One word you've missed out, Ashish, it's actually a very lovely team as well. I've had a chance to get to know many of you here. And my lovely audience. I promised that I'd open it up. Wonderful gentlemen's there bidding for the first question. Can we please get a mic to him? And then who's my second bidder for a question? Fantastic. I want to see some, I will be charging them with smiles. We've got a couple of minutes on the clock, that's it, so very quick, please.
Hi, thank you for a great panel. My name is Umar Faruqi. It's great to hear this collaboration taking root. The one question I had is, there is concern around building guardrails and offenses for deploying AI effectively. It's one thing to get the model right or the output validated, but getting it deployed effectively is not that simple. And there are examples of coalitions like CHAI working on developing guidelines. What is M42 and the Advisory Council's vision around that? And how do you plan on addressing that challenge?
Great question.
Should I? Yeah. So I think answer is straightforward. One of the reasons, if you see Med42 and our approach to that, it's open access. It's up on Hugging Face to download. We want to work in a collaborative manner, identify the risks, which we have not done, and it's a journey. And I think a couple of factors that, especially in the healthcare space, before you roll out into the clinical workflow, it needs to get, I think, what I addressed before, the physicians to come on board and sign up for that. This is what I see missing across the other models, maybe the ones that you're referencing to. You have to ensure it's collaborative and it's interdisciplinary. You have that, and then you ensure it's transparent, and you can address all the bias one step at a time, but it has to be open access, and that's one of the core decisions that we are building these models, and it's up on public domain to scrutinize it and share with us the feedback.
Fantastic. Thank you so much. And if I can ask the gentleman to pose your question. Quick one, please.
Yeah, I'm Vineet Kumar. I build technology for different areas in healthcare. How do you, being old is not yet categorized as a disease by FDA or in any country. So how do we get insurance to cover for longevity-related solutions, products?
Really good question, Dr. David Sinclair.
All right. Aging, I believe, is a medical condition that should be treated and is increasingly treatable. But you're right. Right now, the issue is that there is no categorization for either medicines or reimbursement to treat aging itself. And so people are trying medicines, trying supplements on their own largely without their doctor's advice or expertise. We need to change that. And the UAE could be the first country in the world, I'm hoping, let's have a discussion, that declares aging as a treatable medical condition. When that happens, the first country to do that will have an enormous amount of attention and investment in this area. Already, there's about $5 billion invested in longevity research and development. That's just the beginning. Longevity research and drug development is where AI was about 5 years ago. And so to combine all of that here in the UAE, in Abu Dhabi with M42, would be a dream come true.
And in particular, this event, we've been partnering with the Longevity Forum to bring some of their world-renowned experts. So as you say, this is very timely and topical. Thank you so much for that question. Do I have another very quick question? Okay, fantastic. Last comment from you all. I reluctantly will be releasing you from the stage because I could be speaking to you all about your expertise for much longer. But a call to action. What might be a call to action? We have audience members here who are experts in the field and new audience, new people, new to the health industry. So what might be a call to action that we can all gather behind? Dr. James Mault.
I think the call to action is embracement of change. We can't be afraid of it, and we're in this room people who have an impact on others from what we say and what we do. There's a lot of hysteria right now. There's a lot of unnecessary hysteria, and that's going to be, frankly, that will delay what could otherwise literally save hundreds of thousands, millions of lives, reduce the cost of care, make care more accessible. We can't be afraid of change. Change is hard. Technology, I mean, when we all think about 20 years ago, maybe not everybody's old enough to remember it, but the internet was scary 20 years ago. The idea of storing your credit card information on the internet, that I was like, whoa, why would I do that? There's a lot of risk there. Now it's commonplace. So everything we do in life is really a decision of the perceived risk versus the benefits that we're enjoying. And right now, people are a little scared, they're apprehensive, and you have to understand that the good of all of this far outweighs the bad. And the thing that I do in these audiences to help people put it in perspective is, raise your hand if you or someone you know has ever been on an airplane. Okay? Well, today, with that plane flying over us, I always say it's a trick question. Who's flying that plane, the pilot or the co-pilot? And the answer is neither. It's the autopilot system that for the last 30 years has been flying those planes safer and more efficiently than pilots 50 years ago. And that's what we're about to experience with healthcare. We're not replacing those pilots, but we're making every pilot better at what they do. And when it comes to healthcare, your doctor and nurse and your hospital and your physical therapist, we are all going to be better at taking care of our patients than we ever were over the last 100 years.
I think that's a very powerful analogy. So thank you so much. Embrace change. Dr. David Sinclair, your call to action.
Well, we are in what I would call a paradigm shift, where there is a lot of scary change, and there is backlash against those who are pushing the forefront. So I echo what Jim just said, for sure. Please don't be afraid of change. It's going to happen. The only question is how fast. And the faster we can go, the better, because people are dying. Every day, about 200,000 people die from an age-related illness, which doesn't have to happen. My call to action is to spread the word about this. There's a lot of fear, and mostly there's a lot of inaccurate information. The internet, God bless it, it's a wonderful technology, but it also allows anybody to have an opinion. And particularly in healthcare, there are a lot of people talking about it, and a lot of people don't know what they're talking about. So I would love for one call to action be to seek the truth and don't believe all you hear out there.
And as you also say, speed is of the essence for a very noble mission. This isn't simply innovation for the sake of innovation. We actually are driven by the same mission for humanity. So thank you so much for underlining that. Ashish, you have the final word. your call to action?
I think I agree with the gentleman here. It's exactly that. It's to educate yourselves individually and understand the risks, choose the right use cases that make the maximum impact. We were discussing about horizoning. I mean, the technology is changing every minute. Adopt those use cases. Use it as a clinical decision support right now. We are seeing real life examples right now where the doctors, when they're seeing, getting a summary of the patient before even actually seeing the patient, the impact that they have, and the facilities in which you can even automate clinical notes back into the EMR, they get to do what they do best, treat patients. If you can adopt the right solutions and understand the risks collectively, I think that's the most important part, the call of action I have. I think look at it and educate yourself and understand the risks and see how we can choose the right use cases that make the maximum impact.
Well, this morning we really appreciate you all taking the time out to explain the vision, to explore the very exciting future missions, and for giving us an insight into behind the scenes. As I opened this morning by saying this is breaking news, only yesterday the advisory board has been launched, and as your dedicated reporter, I'll be going into one of these council meetings. I'm inviting myself. I'll let you know what it's like, the chemistry behind the scenes. It's been super fascinating to hear about the journey thus far. We wish you the best going forward. Ladies and gentlemen, please give them a big round of applause. We're going to take one photograph. If I can ask the photographer, thank you, Farah. Thank you so much. We'll be back in a few minutes' time with the next session. That was fantastic. Thank you. I didn't even get a chance. Thank you.